guys, in today's video I'm going to be talking all about using retinol if you have sensitive skin, including the sensitive skin condition rosacea. This is something I get questions about all the time, both here on YouTube as well as over on my Instagram. Can people with sensitive skin use retinol? Short answer, you absolutely can. However, there are some things that you should know going in that will help you in guaranteeing success. If you're new here, welcome. My name is Andrea and I'm a board certified dermatologist and I love sharing skincare tips. So I would love it if you would subscribe and hit the thumbs up button. It really helps my channel out a lot. First of all, what exactly is sensitive skin? Sensitive skin runs the gamut of symptoms, including burning, stinging, irritation, redness, maybe dryness and peeling that occurs with the application of topical products. It's something that you might actually be predisposed to by virtue of your genetics. Maybe you have some underlying skin condition like eczema that makes you more prone to sensitive skin, or it could just be a phase of life. Things in your environment that can trigger sensitive skin include changes in humidity, like when it gets drier, your skin can become more sensitive. If you are in the sun a lot, your skin can become more sensitive. If you're using skincare products that disrupt the acid mantle, then you may find that your skin not only is more prone to dryness and irritation, but you develop symptoms of sensitivity. Retinols and retinoids, these are forms of vitamin A. They help facilitating skin cell turnover. Basically, they help skin cells exfoliate, but they're really drying and irritating. And when you first start them, you go through a period called the retinization phase, where you have a lot of peeling, a lot of redness, a lot of irritation. For people with sensitive skin, this is almost, this seems unbearable and, like, okay, I can't use this ingredient. I already have sensitive skin to begin with. But rest assured, retinol is not off the table if you have sensitive skin. There are some things that you can do to introduce retinol into your routine and have success with it and continue to use it long term, even if you have sensitive skin, including the most sensitive skin condition, rosacea. Retinol and prescription retinoids actually can help rosacea, so long as the patient is able to get through that retinization process and tolerate it. So what can you do to ensure success when using a retinol if you have sensitive skin? Number one tip is to prepare in advance. 2 to 3 weeks before you start using a retinol or prescription retinoid, start preparing your skin by consistently moisturizing before starting the retinol or retinoid. The last thing you want to do is to be applying retinol or retinoid for the first time on dry skin. So go ahead and start amping up your moisturizer routine. Really start dialing back on the frequency of cleansing. You really only need to wash your face once a day. If you've been washing your face more than once a day, switch to just once a day. Because when we wash our face, we remove some of our natural lipid barrier and we end up losing more water, we're more prone to dryness and increased symptoms of sensitivity, burning, and stinging. So switching to a just once a day cleanse can really help. And take a look at your cleanser. Make sure that you're choosing a cleanser that is gentle and not full of harsh surfactants that are further going to strip the skin barrier. I will list down below in the description box, you guys, some moisturizers and cleansers that are great for people with sensitive skin. The other thing is to scrutinize your skincare routine and cut out any unnecessary active ingredients. For example, if you were using alpha hydroxy acid, beta hydroxy acid, anything that already is going to start exfoliating the skin, I would consider getting rid of it in preparation for starting the retinol, because these things, if you are using them and then you start retinol, it's going to increase the chances of irritation and stinging even further. Beyond kicking out any unnecessary active ingredients, also kick out any unnecessary products. If you've got a 7-step skincare routine, cut that out. Keep it very simple and start with the simple skincare routine in advance of starting the retinoid. All you need in your skincare routine is sunscreen, moisturizer, cleanser. Now, when you actually start the retinol or retinoid, it's going to instruct you to start on clean skin, to wash your face first. So pay attention to how you wash your face. Make sure that you wash your face in lukewarm water. You don't want to use hot water because that's going to remove more of your natural lipid barrier and set you up for failure when you apply the topical retinol or retinoid. And again, as I said, in terms of the preparing step, you should be using a cleanser at this point that's very gentle. Tip number 3, as you're using the retinol and introducing it into your skincare routine, don't neglect that moisturizer. That's gonna help you so much with tolerating the side effects of retinol or retinoid by reducing transepidermal water loss. Now, there are differences in opinions on how best to incorporate the moisturizer alongside retinol or retinoid in your skincare routine, and honestly, there's no right answer. Whatever works best for you is the best answer. I always tell patients that after they rinse their skin from cleansing to go ahead and apply the moisturizer right away while the skin is still damp. This really helps the moisturizer lock in hydration and reduce that transepidermal water loss that can occur from cleansing. And then once you've done that, allow the moisturizer to dry and absorb fully, and then apply a pea-sized amount of a retinol or retinoid to the skin. A lot of people will ask, does that interfere with the ability of the retinol or retinoid to get into the skin? It doesn't, it's fine, it works well. Other people like to apply the retinol first and then apply moisturizer on over it. In my opinion, that's not as good because you're basically putting the retinol on a freshly washed face that's not moisturized. So you're putting it on a skin barrier that's already losing water. So it sets you up more for irritation. And then another popular method is the sandwich method, where you put the moisturizer on, you allow it to dry fully, then you put the retinoid or retinol on, allow it to absorb fully, and then you put another layer of moisturizer on. That's fine too. You know, I don't typically advise people to do that, but if you're using that method and it works well for you, keep doing it. Tip number 4 is the form of topical vitamin A that you choose. Retinol is what you'll find in cosmetic formulations that you can buy in the store. You can also go with retinaldehyde. Now retinol and retinaldehyde, they're much gentler than the prescription retinoic acid because your skin has to kind of do some additional work on those ingredients to get them to their active state. So they're a little bit more slowly introduced into the skin, but with long-term consistent use, they are effective. They take longer to start working, but the irritation process is much, much less. I will list down below in the description box some gentle over-the-counter retinols and retinaldehyde that I think are good for people with sensitive skin to try out. For example, the Retin A, this is a retinaldehyde cream. That's very moisturizing. It's a good one to consider trying out if you have sensitive skin. Tip number 5 is don't overdo it with the amount that you're using. You really only need a pea-sized amount. I'll show you here with the Aven product. You really only need a pea-sized amount. You don't need a big glob to cover most of your face and a thin film. The thicker the film, you're just getting more irritation, and you're not bumping up the efficacy at all, and you're just kind of wasting it and causing more irritation. Tip number 6, go really slow. I suggest starting using the topical vitamin A, whichever form you go with. Use it once a week for 2 weeks even. And if you're tolerating it okay at that point, bump it up to twice a week and see how you tolerate that for a few weeks, and then slowly increase to 3 nights a week. And kind of see how it goes, and try and increase to nightly if you can. You don't necessarily need to use topical vitamin A every night for it to work. Using it as little as 3 nights a week has been shown to yield the same results as using topical vitamin A nightly. It just takes longer to get there, but you get there with less irritation, which is really key if you already have sensitive skin. Tip number 7, when it comes to choosing the form of topical vitamin A that you're gonna go with, try and stick to a cream. You have creams and you have gels. Gels can sometimes have low molecular weight alcohols in them that are drying, and that can cause more symptoms of irritation, stinging, burning, dryness, especially for people with sensitive skin. Those gel forms are great for people with really oily skin. They're fast absorbing, they're not greasy or whatnot. But for people with sensitive skin, creams are a much better way to go. So for example, the Aven product is a nice cream. And the nice thing about the creams is they have ingredients in them that help address the dryness and irritation. So the Aven product's really good. The Neutrogena Rapid Wrinkle Repair Regenerating Cream is fantastic as a moisturizer with retinol. That's a sustained action retinol, so it's kind of a slow release formulation. And then my final tip for those of you with sensitive skin who are looking to introduce retinol, beyond introducing it very slowly, is to train your skin to kind of get used to it. And the way to do this is to just do a very short contact time. This requires a lot of patience, but it can really help a lot if you do the work up front. And what I mean by that is apply the retinol to the skin and just leave it on for a few minutes and then rinse it off. And you know, slowly do that maybe once a week, and then slowly increase the amount of time that you keep it on the skin before you rinse it off, and working up to leaving it on overnight and then rinsing it off in the morning. That way your skin kind of starts to get used to those irritating side effects in a more gradual fashion, and it makes it much more bearable for you. In fact, if you have rosacea, I would advocate doing that for sure. Just to kind of work your way up to it. I think that's the best way. So to be clear, you know, I get a lot of questions as a side note, do we need to wash retinols off in the morning? You don't, but for those of you out there with super sensitive skin or rosacea, this short contact approach of introducing it and then rinsing it off helps a lot in building up the tolerance to be able to actually then go on to use it on a consistent, ongoing basis, if that makes sense. So those are my tips for those of you guys out there with really sensitive skin or rosacea who want to try introducing a retinol or vitamin A into your skincare routine. And it really can have benefits long term for those of you with sensitive skin, because it actually can help strengthen the skin barrier. You just have to get over that period of time of the dryness and irritation. So hopefully these tips help you navigate that with success. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.